Hi everyone, I'm Dr. Mila Brujic, and today I'm joined with Dr. Damon Dierker, where we're going to be talking about eyes on dry eye on the Optometric Insights show. So Damon, thank you for being here with us. I remember meeting you early on in my career, and you've always been an interesting guy to really communicate with, talk to, collaborate with. Tell us a little bit more first about your practice, kind of what your modality is, where you see patients, and how that all works.
Yeah, thanks. I would say the same with you in our interactions in the past. I appreciate the opportunity to be on the podcast here. So I'm a partner at Eye Surgeons of Indiana in Indianapolis. We have 4 locations. I see patients at 3 locations. I'm in clinic 4 days a week. Pretty busy clinic. I'm seeing about 150 to 170 patients a week over those 4 days. Intense dry eye clinics, and then a lot of patients that I see have retina issues as well as glaucoma. And then our practice as a whole, we do a lot of refractive cataract surgery. I'm involved in some of the perioperative care for that.
That's great. So you're kind of involved in almost everything in the practice, right, Damon?
Correct.
And it sounds like an MDOD collaborative practice as well, too. I'm assuming that you get referrals in from outside sources, other optometry practices, and everything like that. Correct?
I always like to correct people on that. I really think of it as a OD-MD practice because we're the frontline providers. We're in the clinics.
That's great.
We're keeping our surgeons busy, and the bulk of the patients for both the acute and chronic care are going to optometrists in our practice.
So you have had this rich history in eye care, specifically in dry eye, and you've kind of led the path for this. Give me just, before we start talking about eyes on dry eye, give me just like 1 or 2 of the things that you see in the dry eye world that are really kind of stepping up and advancing the way we care for dry eye patients.
Yeah, I think that's a great question, and I think awareness is a big part of that. We actually did a survey at Eyes on Eye Care that we're going to release at Eyes on Dry Eye in late April, and we asked about 800 eye care providers, mostly optometrists, things like, is meibomian gland evaluation part of a comprehensive eye exam? 85% of people felt like that's part of a comprehensive eye exam, if you can believe that. And thinking back 5 or 10 years, can you imagine us even having any idea that people would be embracing that like they are now? We also see that 60% of people want to expand dry eye services in their practice. So people see this as a need to help patients, to be a profit center for their practice. So I think awareness of how much dry eye is out there, as well as the opportunity to not only help your patients, but to help your practice. So I think that's number 1 is awareness. Number 2 is we just have a lot more tools to be able to treat the disease. We understand that this is not, a disease with a lack of tears, it's poor quality tears. And so much emphasis has been on meibomian gland dysfunction and in-office treatment, but we have great therapeutic agents, topical steroids, immunomodulators, and I think there's several things in the pipeline that I expect to come out in the next couple of years that are going to change the way we practice. So, having all of these tools and just making sure that you understand how and when to utilize these so that your patients can have great outcomes.
Yeah, I mean, don't you feel I would say the last 5 to 10 years, we've become much more targeted with our therapies. I remember a time when we had one FDA-approved prescription product for dry eye, and that's kind of like what everybody got. And then we started to become much more targeted based on our utilization of advanced diagnostics, and also what we're seeing at the slit lamp and what we're hearing, to really laser focus our ability to really get to the root cause of what we feel is causing the majority of the signs and or symptoms. I mean, do you kind of feel like we've really evolved into that realm?
Yeah, I think that the awareness that it's not just one disease, it's multifactorial. There's a lot of reasons people develop dry eye. We have to look carefully at our history, our diagnostic tests, and then really develop personalized treatment plan. And I look at, the different options that I have. Today I was in dry eye clinic all day. I probably had 30 different treatments that I prescribed for patients over the course of the day. So that makes it a lot of fun and makes it really interesting and challenging. And I really like having the opportunity to have all of those tools at my disposal. And thinking back 10 years ago when I probably wasn't so interested in dry eye, we didn't really do much like you said. And now I think out of a need in my community and need in our profession, I've really embraced this in my practice, and then have really loved the ability to be able to share this information with others, to be able to help them develop these sorts of practices with, in any practice setting.
Yeah, I agree, Damon. I think it's whenever you have a patient that you can manage, that you can provide some type of relief for, whatever you're talking about, it always is kind of encouraging from a clinical perspective. You always kind of get that pumped up feeling, all the way from the -2 that needs lenses to the individual who might have severe keratopathy and you're fitting with a scleral contact lens as a moisture chamber. So again, you cut the spectrum of everybody there, and it's very empowering clinically. It's one of the things that I think drives most of us. So having treatments for things kind of engages you more because you can help or fix the problem.
I mean, think about the other diseases that we manage, glaucoma. We're not going to make a glaucoma patient be better or feel better. We're going to probably drive them into our dry eye clinic to what treatment they have, right? For patients with AMD, with diabetic retinopathy, we're not going to make those patients better. We're not going to be the ones doing cataract surgery. So I think dry eye is in the therapeutic space. And I had a staff member today, we delegate a lot of procedures and education to our staff, and the patient came back and had a really nice outcome after an in-office procedure that a staff member did. And they're like, wow, I'm so happy that this patient is doing so well. I wanted to share that with you, Dr. Dierker. And
that's great.
That team approach, that we're all in this together and being able to take care of these patients at a very high level, it's quite rewarding for everybody involved.
I think that's great, Damon. So it doesn't surprise me when we kind of go on to this next segment, because I wanted to pick your brain and kind of get the insights on this. This past year was, the COVID year was the year that kind of changed everything for everybody. And you really and you've done this from a clinical perspective as well too, but you've redefined the way that education happens. And I want you to share with the audience, for those that may not necessarily be aware of this, what you're doing with dry eye education and how you're doing this and how you're making it as engaging as possible on these web platforms.
Yeah, so it's been quite the journey. I look back at probably 2012 when I really got interested in dry eye in my clinic. And there really wasn't any programs I could go to that were turnkey to help me understand how to bring in point of care diagnostic testing and how to, understand how to use these new technologies for both diagnostic and therapeutic. So I went through a process to teach myself those things and engage with colleagues like yourself to be able to understand how to bring better care into my practice. But I don't really think that's realistic for our colleagues that are busy doing other things, right? So I felt like I needed to develop some education programs that would help people understand how to do these things that were very interactive, engaging, that were fun. So we came up with this concept of dry eye boot camp in 2015.
Yes.
Dressed up in military fatigue.
Yes.
Tell it like it is. And we've had, all sorts of the top names, both ODs and MDs on faculty. And then all of a sudden, obviously with the pandemic, the ability to do these things live and in person all of a sudden stopped. So we had a program scheduled for May of 2020 that I would have loved to have done in Atlanta, but it was like, no way, nothing was happening a year ago. So I got together with my friend and colleague, Ahmad Fahmy, who had a similar program, interactive. His is a little bit higher level in terms of more geared towards the intermediate to advanced practitioner. Mine is more beginner to intermediate. And we said, hey, let's do a virtual program together. And we paired with Covalent Events and put on a program last August that had almost 2,000 attendees. And it was very fun. It was very engaging. We had multiple tracks going on. It was probably the closest thing to a live in-person meeting that you were going to get in the age of the pandemic.
That's great.
So now we've kind of doubled down on that, and we've evolved into Eyes on Dry Eye, and our program is going to be April 23rd and 24th. As of today, we have almost 5,000 registered attendees for that program, which is phenomenal.
Unbelievable.
And the ability to have interact with the audience, to have polling, to have fun panel sessions, to have both CE and non-CE tracks, to talk about implementation. Really, the platform that we have with Eyes on Dry Eye allows us to do things that you can't just do during a basic Zoom meeting. But makes it very fun and engaging for the attendee, for the faculty. And I think if you do these things right, and you keep your treatment patient-centric, I can develop a program with the help of others that is going to help doctors, it's going to help their patients, it's going to help their practices, it's going to help industry. And what I want to do is do things that are engaging where everybody wins. And I think we're able to do that in the dry eye space with the virtual program that we have.
So David, I have to ask you, and listeners, you'll be able to see the website under the video here, but I have to ask you, with an online education, how do you keep it engaging? How many hours can the attendee to expect to be on each day? How do you keep it engaging so that somebody can stay on there for the full time with you?
Well, I like to have options where we go. So we have 3 or 4 different options during the entire program. That's what we did last year, where we have CE track, non-CE track. We have an exhibit hall. We have an ability to go in and just shoot the breeze with your colleagues, different interactive activities. So I think having multiple choices going on so that, boy, I'm not really interested in this subject. Yeah. I'm going to go over to this other track and have it be continuous, spontaneous, and fun. I think that's the biggest thing is you can't just lecture online. I think you have to have discussion. I think you have to put out polls to the audience. I think you have to look at what's going on in the chat and bring those attendees into the live meeting as much as possible. So the bulk of our meeting is live. There's a little bit of pre-record on the CE track, but everything that I'm doing on the non-CE side is live and spontaneous, and we're just having fun and having a conversation and giving people real world advice. I don't think you can do that for 8 to 10 hours a day. I think 4 or 5 hours a day is about the max to do that. We give people breaks. There's things going on in the exhibit hall. We have raffles. We have scavenger hunts. So things that can keep people engaged the entire time. It's not the easiest thing to do, and we keep getting better at it with every program that we do. But I think Eyes on Eye Care and Eyes on Dry Eye, we do it better than anybody else out there.
So Damon, are you, as we kind of start creeping out of the pandemic here, you guys have done such a nice job online. Are you going to continue doing it online? Are you going to go back to live? Or are you maybe going to offer both of them as options?
That's the $1 million question. I think I've told people in 2022, I expect to be doing things that are hybrid. I think that virtual education online can be very effective. I think people want that. People want to have access to the top experts around the world without having to leave their living room.
Yep.
And I think that at the same time, we need live in person to be able to give a handshake or give a hug to a colleague and interact with the exhibit hall, et cetera. So I think probably hybrid is the way to go, but I haven't totally decided how that will look at this point. We'll put back in fatigues, or if we're going to be button up collar on a stage.
Well, I'll tell you, Damon, I trust that you're going to do it better than anybody else with what you've done already and what you're continuing to do and how you're reinventing the education space. I know that sometimes it's difficult for patients or for practitioners to drive to meetings or get on a plane to get to a meeting and this kind of thing. And that's where they're going to see the experts, and you are making those experts successful, and we appreciate that. And if you like what you heard today, make sure you subscribe to our channel. Dr. Dierker, thank you for being on the Optometric Insights show, and colleagues, thank you for tuning into this episode.